Good day, everyone, and welcome to today's webinar, Visual Clinical Guidelines, the Automated Visual Guideline Summary Generator. So today joining us is both Dr. Curtis Harrod and Justyna Lityńska. So firstly, Dr. Curtis Harrod is an epidemiologist and a biostatistician and a senior scientist at the American College of Physicians with nearly 20 years of experience in evidence synthesis. Formerly an assistant professor and research director at Oregon Health and Science University. He specializes in translating medical evidence into clinical policy and guidelines for public and private insurance, including state Medicaid programs. Dr. Harrod led the development of the ACP's interactive visual clinical guidelines to make data and recommendations more digestible for users. He also co-led the STEM project, which is the systematically testing the evidence of marijuana, providing clinicians with user-friendly resources on the clinical effects of cannabis. He has also published extensively as a lead and senior author in the top-tier medical journals and frequently recognized as a top peer reviewer, and was awarded a Fellow of the Guidelines International Network in 2025. And Dr. Curtis will be taking us through the history and the impact of visual clinical guidelines. Then we have our very own customer success manager here at Evidence Prime, Justyna Lityńska. You may be familiar with Justyna if you've ever contacted the GRADEpro or Laser AI support. She has coordinated Evidence Prime's collaboration with various projects, including the Canadian post-COVID condition guidelines and the COVID-19 recommendations map project, as well as the WHO Global Tuberculosis Program. Justyna partakes in multiple workshop sessions and supervises the GRADEpro knowledge base. And Justyna will walk us through how to make use of visual clinical guidelines in GRADEpro. So now I am going to give the floor to Dr. Curtis Harrod to discuss visual clinical guidelines further.
Thanks so much, Kirsty. I'm happy to be here today and happy to be talking to you all about the visual clinical guidelines at ACP. And so why did we really dive into this area? Well, we know that the landscape of guidelines has evolved, and the amount and availability of materials that are available to clinicians and patients that they can or will consume has greatly expanded, especially in the last 1 or 2 decades. We also understand that guidelines are generally text-dense and lengthy publications. If you find one in a peer-reviewed journal, it will be a little bit more brief because there's a word count limit. But if you happen to stumble upon an organization report, those are typically 300 to 400 pages long. And so the way people consume scientific materials, we also know is evolving, and ACP wanted to evolve with it. So that is why we developed the visual clinical guideline that is powered by GRADEpro. And we wanted to make our clinical guidelines 3 things, really: more interactive, more visually appealing, and more accessible. And so today I'll walk through an example, and I'm going to share my screen so we can all see it here in just 1 second. I'm going to walk through an example on migraine treatment. So this is a published clinical guideline, an ACP guideline, and it's available within Annals of Internal Medicine if you'd like to view it there. But I've got the visual clinical guideline displayed here. Hopefully you all can see it okay. So at the front of the VCG, so we call them VCG for short, given visual clinical guideline can be a little bit of a mouthful, we display the scope of the guideline. So we've got our populations of interest, methods and process, and then interventions or the treatments that are being evaluated. In this case, we analyzed pharmacologics. So one thing we really try to hone in on within the VCGs is we give the option to explore more, but it's not by default typically. So if you want to learn more about our methods and processes, we provide a hyperlink to go ahead and jump to the publication on ACP's methods and processes. And I'll show you a few other places where we give the option of more narrative text if you would like to read or dive deeper. but by default, we try to streamline what is presented. So right away after the scope, we get into our recommendations, as that's the key to any guideline, right? So in this topic, we have 2 recommendations. I won't focus as much today about what those are and specifics on who the population is, etc., as this is a more high-level overview of what information is within the visual clinical guideline. But you can see we've got 2 recommendations. They're both for, right? So there's not an against recommendation. One is strong. So our first recommendation is strong. Our second is conditional. And so right away, you can probably see things start to pop up on your screen as I hover over those text boxes. So the strong, we actually have hover text describing each technique or grade, a specific domain that maybe folks aren't fully initiated with. So we describe more in a lay way what strong means for recommendation and what conditional means for a recommendation. And beyond that, we have our certainty of evidence. So in this case, we have low for our second one and moderate for high. You can hover over that and see a more lay interpretation of what those mean as well. And as I mentioned in the beginning, we have the option to explore further. So if you'd like to see the narrative rationale for each recommendation, you can click on the show feature here, and you can see again a longer text-dense explanation of the recommendation. We'll have one more option to dive further, and I'll get to that here in a second, but those are all optional to the viewer. Again, you can use hover text, you can have the additional functionality, and then we have our accordion text here. So clinical considerations are a key component of ACP guidelines, and those are listed verbatim from our published guideline here if you would like to explore what those are, and they'll be topic specific. And then we have our citations, again in accordion text, so not displayed by default, but optional. And you can see our full clinical guideline citation as well as our systematic reviews that informed the ACP clinical guideline. So the other option that I alluded to dive in further about the recommendations is the data interactive. So you can explore the data behind the recommendation. And so right away, again, more hover functionality. We've got the instructions on how to interact with the data visualization. And then we've got what type of estimate it is. So if someone maybe not fully familiar with a risk ratio or an odds ratio is, we try to explain that with an example so they'll better understand it. And of course, we've got our population. And so I'll go to our recommendation option. We had 2. We'll start with triptans and NSAID, the combination therapy there. And so our recommendation text will be displayed by default up at the top, and I'll flip over to the second one, and that will automatically change, as you just saw that happen now. I'm going to go back to our triptans and NSAIDs, and let's walk through some of the visualization here. So I'm going to pick one where there's a little bit more data. So triptans plus NSAID versus triptans alone, so versus triptan monotherapy. And you can see, again, we have our effect size. This case, we're looking at relative estimates and mostly risk ratios within this analysis. But you have the option also to explore absolute risk differences per 1,000 treated individuals. So you've got both of these options for the outcomes that were analyzed in this topic. And the outcomes are displayed up at the top. And there's definitely some overlapping with these outcomes. So we've got pain freedom at 2 hours, pain relief at 2 hours, sustained pain freedom up to 48 hours, etc. And our harms are over on the far right. So we're ordered by benefits on the left, harms to our right here. And you can probably see within the figure that the quadrants are shifting. So hopefully the color coding is a little bit intuitive, but we still have the text describing it if it's not. So we have favors triptans plus NSAIDs in the first quadrant as well as the fourth quadrant. And then the opposite of favors triptans, and that's color coded being in red versus in green. And so our y-axis is our risk ratio here, or our range up to 4 we went to, and this can be customized based on the data you have. Obviously, if there's a lot of imprecision within your estimates, you might want to expand beyond 4, although it gets a little problematic because the space under 1 is very finite, right? 0 to 1, space above 1, especially with the risk ratio, is infinite. And so the scaling can get a little tricky to address. And so in this topic, we selected 4 to capture the most data possible. And as I hover over the data here, you can see a fairly lay interpretation of the finding, along with whether it was statistically significant or not, the risk ratio and confidence interval itself, and then where the estimate came from. So a network meta-analysis, a direct estimate from a pairwise meta-analysis, etc. And so I can hover over these, and you can see the interpretation, if it's not different, right? So we have triptans plus NSAIDs probably resulted in a higher likelihood of sustained pain freedom up to 48 hours by 1.3 times. So a risk ratio of 1.26 there. And so beyond the visualization here, we have our certainty of evidence for each outcome displayed at the bottom with the Hoover text describing what those are. We also, when we do not have data, say no data. We also do not present data when we have insufficient or very low certainty of evidence data. So those are all displayed within the figure for interpretation purposes. And again, you want to flip the outcome. So for pain freedom, etc., it's good to be above 1. For things like overall AEs or serious AEs or rescue medication use within 24 hours, it's good to be under 1. So preventing that outcome from happening due to it being a harm. So when the effect lands in the green box, it's always a good thing. For the intervention, when it lands in the red box, it's favoring the comparator or a bad thing for the intervention. So I'll just quickly switch over to our absolute risk differences so you can see that as well. Again, the scaling is always customized by topic. It should be considered based on the data you have. And then we've got our interpretation for these analyses as well. So you can see that as I go over the Hoover text, it's describing what the ARD is in the context of the finding and the outcome, and also using the grade language of probably for matching with moderate certainty of evidence, and then low for, may for low, and then no caveat or probably a may if we have high certainty of evidence. So in this case, just results in a higher likelihood of sustained pain for relief up to 48 hours by 130 more events per 1,000 treated individuals. So that's just a quick overview of the interactive itself, and you can switch the comparators based on what you want to see. So clearly, because we have comparative effectiveness data, there's not a lot of comparisons to just acetaminophen alone. We do have, I'll jump over to our relative estimate here, some effects for the CGRP inhibitors as a comparator. And then you can, of course, switch your recommendation and start all over again. So you can look at the triptans plus acetaminophen, and then whatever comparator you would like to look at. So either acetaminophen alone, NSAIDs, or triptans. So we display what data we have there. The last thing I'll just briefly run through is the cost figure. And so the costs are, we use annual wholesale acquisition costs. So we get our data based on WAC for sure, and then adjust it to be an annual rate here. And this is, of course, context to the US, and then we provide our date. So this guideline was published in 2025, and the data were pulled and abstracted and analyzed in 2024. So you can see there's definitely differences in cost with regard to these migraine treatments. Some of which are generic, so it will be a lower cost. Others are over-the-counter, like NSAIDs, acetaminophen. They'll be much cheaper. And then others are just brand name, and they'll be much more expensive, especially when you look at the wholesale acquisition cost. So that's a quick overview of the visual clinical guideline, specifically on our migraine treatment guideline. So I'll go ahead and stop sharing now and turn it back to Kirsty.
Okay, I'll jump, I think, in front of Kirsty. Time is of the essence here, and we have a lot to present today. So just as a brief reminder, my name is Justyna, and I will present the technical part of creating a VCG in GRADEpro. Yes, we are here. A brief introduction I need to make is that VCGs were created to be supported by the content that exists in GRADEpro. So as you go through the project, you gather your data, you assess the data, and then you make recommendations based on the evidence. Afterwards, we want you to be able to create a VCG, to create a visualization easily without the input of a graphic designer and without going back and forth with various designs. So we do our best to reuse as much information as possible. We mostly rely on data from two modules of GRADEpro. First one is NMA evidence, so the network meta-analysis evidence that was the main source of the data for VCGs when we were co-designing them with the ACP, and the second most common source of the evidence for NMA is a multiple intervention ETD, so the recommendation part that evidence with the final recommendation text, the certainty of evidence and the strength of evidence that are to be presented to the final user. Those two modules, NMA and multiple intervention ETD, were presented in detail in the previous webinars we did, and I will mention some elements of those, but I will not go into much detail because otherwise we wouldn't be able to complete this within the hour. So if you find you have some questions, feel free to go to the webinars we did in the past. They will be pasted in the chat, and of course shared with the materials after this webinar. So what the expectation of what you have in a project before you start creating VCGs is this. First, you have the evidence in the NMA that I mentioned. So you have evidence for various outcomes imported from an outside statistical software, and in each outcome you have a grid of interventions and comparators. Each intersection of that grid is a single comparison of a intervention against a comparator, and we have the relative effect assigned. We have the absolute effect where applicable. We have the certainty of evidence calculated, and the colors you see represent the magnitude of effect. So the brighter, the stronger green, the more positive effect, and the larger the positive effect. And of course, we read the effect is negative. So that's what the source of numbers that you will see in the VCG, and that were presented by Curtis on the plot. And regarding the element, let's say the more narrative elements, so the recommendation, the rationale, the list of interventions and populations, that comes from the multiple intervention ETD. So when we create it, we decide what are our interventions, so what's the comparison, what's the population. All those details will be taken into the final VCG that we make, and of course the recommendations from the bottom of the ETD will be taken as well. So in this case, we have 3 recommendations. One recommendation is against in case this wasn't clear so far, the recommendations refer to the treatment of type 2 diabetes. This was the original guideline made with the VCG, the very first one, and there were 3 recommendations made: one against DPP4 inhibitor, and two for GLP-1 agonist and SGL2 inhibitor. So this is the materials we have. So imagine all those work-intensive months of systematic reviews and making recommendations with the panel. Those are behind us. Now we want to present it easily to the final audiences, and since we spent so much time making the systematic review and making the recommendations, we want to spend as little as possible on the dissemination, and that's what we're here to help with. So as any dissemination method, we go to the dissemination module in GRADEpro, and there's the VNI tab, which stands for Visual and Interactive. That's one of the aspects of the VCG. I already have one prepared here, but let's start from scratch. So we have the Create New Visualization button, and at the first step I have to decide is sometimes the hardest. So the title, the topic name. In this case, this is going to be new pharmacological treatments in adults with type 2 diabetes, and I have to select which recommendations I can include. So there was the multiple intervention question I mentioned, and once I mark it, it automatically marks all the recommendations in this question. If I wanted to use only some of them, I can, but in this case I'm using all 3, so I leave them check marked and click on Create. And now it appears here. New pharmacological treatments. I enter, and what you see now is what was sourced automatically by GRADEpro. So as I mentioned, the population are populations is sourced automatically. The list of treatments or interventions is sourced automatically, as well as the 3 recommendations made in the ETD. That's what we start with, and that's what we can edit to our liking. So we can enter the guideline title. It is separate because at times the title of the guideline itself is different than the title of the presentation you're making, so it could be done differently. You can enter the publication date, and by this we mean the publication of the guideline document itself, so not the time when this final presentation goes online, the date when the guideline became available. In this particular case, this was 19th of April, already 2 years back. And yeah, that's so in case of populations and interventions, I don't need to edit anything at the moment, although I can. So if I wanted to give, for example, the full name for those interventions, I can edit them too. Now comes the recommendation part. So as Curtis mentioned, you can provide the rationale behind the recommendations. You can also consolidate them, and that's what we are going to do, and that's what actually happened in the original recommendation. So as you can see, there are 2 strong recommendations for 2 different interventions, but they were finally combined in a single one, and that's what we are going to quickly do. We can just save this one since it's no longer needed. We can discard. And just to make sure we don't do that, accidentally, we're always asked if we are actually sure. Yes, and now we can add the rationale. So I have the rationale for original recommendations on hand. So we can paste it in or type it in. You can work directly in GRADEpro if you need, of course. And we can also do some visual tweaks. So, for example, what happens in ACP recommendations is also that the keywords, so that recommends or suggests or recommend, suggest against, are bolded, and they are colored accordingly. So in this case, this is going to be recommends against, so we will make it bright red just to make it clear that it's a negative recommendation, and in this case the recommendation is positive. So let's make it green and save. We can select the certainty of evidence. There are cases in various teams when the certainty is intermediate. That's why we give the option to mark, for example, if the recommendation was low to moderate, then we can mark it this way. But in this case, the certainty is high in both cases. And basically, that's the end of my working with the recommendations, because I had everything prepared already in the ATD. Now comes the part with clinical considerations that Curtis mentioned. So of course I can enter the clinical considerations here as well, and those parts are customizable. So in this case, for example, the clinical considerations and 2 citations, one for full guideline and one for evidence review, are as they were made for the original guideline by ACP. And by the way, at any point, if I want to check what I'm doing and what it's going to look like in the final presentation, I can always use the preview part, and here I see what it's going to look like. Data is empty for now because I haven't imported anything yet. And as you can see, those text fields are available here. So if if my layout is a bit different to ACP's. So for example, I don't have the citation for evidence review. I only have the citation for full guideline, but I have a different item, for example, justification. Then I can edit this field. I can rename it, save, and I can even move it higher if I want to. And let's just paste something in for now. But if I go to the preview, there is the justification which can be previewed. So you can customize this part to your liking, and basically that's what can happen with the entire structure here. So you can add more recommendations. You can add recommendations from multiple ETDs in a single presentation. It is up to you how this visual or narrative part is completed. Once it's done, we move to the interactive part, which is the evidence that will go into the final plots on the VCG. And the way it's entered is organized in a table with 3 columns. There's the recommendation option, recommendations, and data, and you go as you would read in English, so that's from left to right. The first in the first column, the recommendations options can be organized under populations. If a guideline considered more than one population, there could be a few sections here, but there's just one: adults with type 2 diabetes mellitus. So let's keep it here. And now I can add recommendation option. So with the first one was SGL2 inhibitor. I just if I make a typo, I can of course correct it. And now, so as I mentioned, we go from left to right. So now when I have the recommendation option, I can attach recommendations or recommendation to it. In this case, only one of those recommendations. This one concerns the SGL2 inhibitor. I go next. I can add potentially recommendation title and tooltip. So Curtis mentioned that when you hover over something with your mouse, you can see additional information. So it's possible to add it here. To save time, we will skip this step for now. And now that I have an option and a recommendation attached to it, I can add evidence, so analysis group. And I select the network meta-analysis that I was showing previously in the NMA evidence module. And once I do, I can select outcomes. I can select all of them or just particular ones if only particular outcomes are relevant for this option. In the next step, I select the intervention. So since in my case, the option is SGL2 inhibitor, so that's what I select. And I can either select all the others or comparators or only some in cases when it would be relevant. And I click save, and basically that's it. So if I go to the preview part now, I will see that the plot appeared here. I cannot yet select recommendation option because I only entered one, but already in this one option, I can select multiple comparators to see the evidence for the numbers were imported and the tooltips that Curtis mentioned are also available here, and the division of the plot is as presented. So we have the part which favors the intervention and part which favors the comparator. In this case, it's not split because all the outcomes are not favorable ones. And that's what you do for each of the options. So let's say let's add the negative recommendation. So this will be the recommendation the recommendation concerning DPP4 inhibitor. Again, I add a recommendation and add the analysis group, select the outcomes, select the intervention, comparators, and now I will have two options to select from. Here the drop-down appeared. I can select DPP4 inhibitor and see the evidence that concerns this particular intervention. So that's where the evidence comes from. Curtis also mentioned the costs. So I can add costs by clicking on the free dot menu here, and there is the costs option. So in this case, the costs are empty, but I have a ready and completed presentation here where the costs are completed. So here I can enter the numbers, the names of the interventions, the values. I can decide what's the chart title, what's the on horizontal and vertical axis. And once I go to the presentation itself, I can move to the costs tab and see the costs. And this can be edited at any point. So if I want to go, if I go to preview, I see that something is not right. I can go back to the parts that I want to correct and change. So for example, here for some reason we have low to moderate instead of high. I can go back to the visual part, change it to high, and then I will momentarily see the correction of what I did. And of course, there's the matter of exporting. So the VCG can be technically exported as PDF. Of course, a PDF won't be interactive, but you can export it either as an external link to which you can direct from your guideline document, or you can export it as an embeddable code. So it will appear on the website you, for example, already have. If you have an existing page online, then you can put the content. There, and that's how the visual is made. If you are not doing network meta-analysis, but you still want to use this presentation for your purposes, there are a few extra steps, but this is still quite possible. So to prepare the evidence, you need, even if you don't make network meta-analysis, you only do pairwise comparisons, you need to have the comparisons made already in GRADEpro. They have to be, the naming has to be unified. So all the interventions have to be labeled the same in each question, and also ideally the same outcomes should be used in all the questions, or at least to some extent they should be overlapping. And if the same outcomes are used across different pairwise comparisons, they must be named the same. So for example, if here I have all-cause mortality, then in the next question it also must be all-cause mortality and not, for example, just mortality. So if I follow those rules, I can import those questions into the NMA. So there is the option to or import the data from summary of findings tables into this. There is the import SOF button. I can select the questions I want to import from. Once this happens, same as if this was a network meta-analysis question, the data is organized into outcomes. In each outcome, I have the data from pairwise comparisons in my questions combined, and this NMA sort of NMA can be used to inform inform the recommendations in a VCG. And I think in terms of the presentation itself, this is it. I imagine there might be some questions, so I think we can have some time to answer those in this case. So I see, seeing that I'm still presenting, and I see some questions that I could answer in the chat. So there is in the Q&A, the question: can the visuals in VCG be changed? The answer is yes. So the example of ACP, of course, follows the ACP's branding with the logo and the colors, the predominant colors, and the footer. The example I was presenting in GRADEpro, so the preview is, let's say, brandless. So that's what it looks like when we don't have specific colors. So once an organization purchases VCG as an add-on to their subscription, we can, of course, modify it to match their branding. So add the colors, add the link to methods. For example, here there is in the ACP there are links to ACP guidelines on methods and process. Of course, in other organizations that will be the organization's own links, and even here there are visuals that symbolize the populations and the treatments that are evaluated. But if you have graphics which are prepared like so, they have the correct size and resolution, then you can click on the population icon and select. So for example, for population, I can choose like a tiny person, and for intervention, there could be a pill. And then in the preview, I will see those particular icons. So this can be edited and customized. I mentioned customizing the sections. So this can, by all means, be edited. As for different types of data in the VCG, so in this particular case, we have the relative estimates. I don't think I have for this, because as this being a mock example, I don't think there will be absolute risk differences, but they can be entered, of course, and there can be data for continuous outcomes. So the mean differences or standardized mean differences can also be presented here. We are also working on implementing narrative outcomes so that they can be presented accordingly as well. As for the there's a question.
Justyna.
Yeah.
I just believe Dr. Harrod could maybe show the different types of information that could be included within the VCG.
Sure. So let me share this. Let me unshare the screen.
Yeah, so I don't have one published yet on the mean differences and standardized mean differences in the same visualization, but we do have one. This is migraine prevention. So I talked about treatment earlier. This is prevention. Data were very limited. We looked at comparative effectiveness, so that's why you really only see the one effect size displayed within the figure here. But you can get a quick sense of the mean differences, similar structure to the relative. There's going to be a flipping of the data within the quadrants, whether it's a good or bad thing. And what we're working on is displaying the mean differences and standardized mean differences within the same selection. So mean differences will be displayed on one figure, and the standardized mean differences will be displayed on the opposite side with the correct scaling. As you can imagine, SMDs are a little bit of a different scale than the mean differences. And so we have that already built in with the module. We just don't have an example published ready to share just yet, but that is done.
Great. Thank you so much. Maybe I can just take over from the Q&A. Is there a limit to how many recommendations that can be entered in the VCG?
So I would say yes and no, meaning that there is no technical limit. You can basically enter and mark as many recommendations as you need. However, as you saw during the webinar itself, the examples so far usually have around 2 to 3 recommendations, and this I think is an optimal number, meaning that if you put around 10, then it would most likely be already a bit hard to read. But there is no but still you can adjust this as you need. So, for example, in case of ACP's guidelines, those are quite compact. So the guideline itself does have around 2 to 3 recommendations. But if your team has 12 or more recommendations, then usually still they are made in clusters which follow the same subtopic of a guideline. So a VCG could be made based on such a cluster, and then you can have like 4 VCGs accompanying an existing guideline.
Great. Perfect. And I know Dr. Harrod, you had mentioned that we're planning on including narrative synthesis within the VCGs. Is there any other development plans in the roadmap for the VCGs?
Yeah, thanks for the follow-up. We definitely always want to improve the visual clinical guideline, and the cost was not an initial part of the development protocol, but then we added cost in. We would like to consider exploring that even further, right? So with any guideline, you should be exploring benefits and harms, cost effectiveness, and then of course values and preferences. So it would be nice to have modules to be able to display each of those components. Cost effectiveness is a little bit trickier as there's less clear ways to network meta-analyze and meta-analyze those data. So displaying multiple studies could be somewhat confusing for folks, and so we're figuring out a pathway for that. And then the values and preferences data for patients and public members, that can be tricky as well because sometimes it's qualitative, other times it's quantitative. And so incorporating that will be important, though, to display as it's all considered within recommendations. So that's where our development pathways are going.
Okay, great. And then we have a question here if there's any work done on pediatrics or neonatal guidelines in Canada or the US. I don't believe we have any teams working on VCGs for this particular topic. We do have obviously users within Canada, and I'm sure that we do have some users making use of guidelines for GRADEpro for the guidelines for pediatrics and neonatal, but I don't think we have any VCGs being worked on specifically for those 2 topics. If it is something that you're interested in considering for your guideline development, feel free to reach out to us at info@gradepro.com or sales at I think it's sales at Evidence Prime, but I'll also pop in my email address if you're interested in learning more about GRADEpro for those 2 topics.
Yeah, so just to add maybe, so the VCG itself as a module is a relatively new phenomenon. So that's why we have so far mostly ACP using this, but of course we would like more people to be able to quickly generate visuals for the guidelines. So we hope to have more.
Great. I think I see a question in chat here, but how can you connect the VCG with a guideline?
Yeah, so the connection can work both ways. So following the example we were presenting of the diabetes guidelines, let me just share my screen again. So ACP is a very good example because quite a lot of organizations or groups already have existing channels of disseminating their guidelines, so like journals or websites where they present it. And in case of any ACP, that's the Annals of Internal Medicine. The guideline itself was presented there, but there the VCG was embedded. And as you may remember, I mentioned that VCG can be exported as an embeddable code, and that's what it may look like. So this is just seamlessly integrated into the website to be presented next to a guideline, so that both can be easily accessed. Of course, there is the option to open for full view, so that, for example, the plots can be easier to read on a wider screen. But then again, once you are here, you may want to go back to the guideline itself. So we made an option in GRADEpro in the settings that and those are settings that also include the scale that Curtis mentioned earlier on. So you can decide like what's the range of the plots that are being displayed. But most importantly, there's a backlink here. So if I enter this link here and apply, then we have a back to guideline button appears, and when I click on it, I do go back to the guidelines. So this way you can ensure that while people can find the visual representation of the guideline, it will not, let's say, overshadow the guideline itself. Both will be available in unison and rather cooperating with one another and enhancing one another than taking away viewership.
And Justyna, if I could just follow up a little bit with,
Sure.
You showed there's an exportable link function. So that's one great way to create a citation. So for ACP, we actually cite the visual clinical guidelines within our guideline itself. And then the separate page that Justyna just showed, it has its own DOI for the publication of the VCG. So it's complementary to it, but because these are interactive, it's not, of course, going to be in the static publication, so the press pages themselves, but instead we cite and guide people to it.
Yes.
Okay, fantastic. Are there any further questions? Please make sure you answer them in the chat. Thank you so much to Dr. Curtis Harrod as well as Justyna in joining us today and taking us through the visual clinical guidelines and how it can be very useful to users and practitioners as well as patients to see this information in an easier, more user-friendly layout. Great. Any further questions or any further notes? Let me just share out my screen here. We have a number of links that you can follow if you're interested in keeping up to date with with the GRADEpro as well as Evidence Prime. You can follow us on all of our social medias as well as our website. And I'll be adding those links into the chat here as well. Thank you to everybody for joining us today, and we will see you in the next webinar. Thank you so much.